First of all, it is a learning phase with or without responsibility. So in this phase, you are not actually responsible for the mistakes you do. You are, if you are self-aware, but you have to develop that habit of taking responsibility of small things slowly and gradually, so that eventually you can be accountable for your work. Second thing, you will discover and rediscover a lot in this phase. Okay, whatever are your pre-notions about what subject you like or what you don't like, will there are chances that it would change. So be open to that change, because you will be the one practicing these things during the course of the whole year. So your choices might change, so be open to that change. Third thing is, you will get to explore a lot. Okay, explore. You have time and space. Okay, so you can explore various things apart from just the duties and studies. Also, studies can be done a long way. I also did, many people did, and they do. Okay, so explore, be open to exploring, because this is the year after that which many things will be decided. So keep exploring. Fourth thing is, you will get to interact with a lot of people, and the key to successful internship is interaction and communication. Interact and communicate with as many people as you can. Even if you are introvert, just try to interact, try to communicate, starting from the watchman of the gate of the hospital or the college, whatever, till the AP associate level, because HODs don't usually talk. So you can talk to associates, like if your HODs are talking and taking good rounds, so you are lucky enough. So this is the thing, like you have to interact and communicate. You will get a insight and perspective to lot new stuff, and also whatever you know, you will get a different perspective to that. So interaction and communication. So what has changed basically? Shark Tank viewers might know this terminology. It is known as TAM. Okay, so TAM is a total addressable market. It will be very wrong for me if I tell patients as a market, but just for the reference purposes, because Shark Tank is going on these days. So basically, target population has changed. We were all dealing with books, okay, till now, but now you are supposed to deal with the patients. So the target population has changed. We were dealing with the question papers, now they have turned into clinical cases. So this has changed, so you have to change your approach also towards various things. Then, talking about the mindset during internship. The mindset which you are supposed to have during internship is learning attitude, because internship is a learning phase. Always be open to learning. Even if you know things, be open to learning, otherwise you will be missing opportunities. So your universe will be giving you opportunities, but you have to grab the opportunities for growing. Okay, so grab those opportunities, be open to learning, keep learning. Okay, so prerequisites for internship. Two things you are supposed to throw in dustbin. Which are those two things? First one is your attitude or ego. Throw your attitude and ego to the dustbin. Okay, throw it to the dustbin. And the second thing which you are supposed to throw in the dustbin is your taking things personally attitude. Please do not take things personally in internship. This is an advice from most of your seniors. We have experienced this. We take things personally. If anyone scolds, then we take personally. If anything wrong happens, we start self-sabotaging. Please don't do that. It will hamper your growth and learning during internship, because in our country it is like a hierarchical system. So from starting from the head of the department, he'll tell the associate will tell the assistant will tell the senior resident, R3, R2, R1, and then interns. So eventually we are the lowermost in the hierarchical system, that's sort of similar to the food chain. So basically everything will be coming to you. So please don't take things personally. Throw that attitude of taking things personally and self-sabotaging in the dustbin for better growth during internship. So I'll tell you about one concept known as internship antigenic shift. Internship antigenic shift. This has been coined by me. So what happened is, so what was antigenic shift? Let's add some academics in this video. So antigenic shift was a major change due to gene reassortment, while antigenic drift was पॉइंट म्यूटेशन की वजह से जो चेंज आ रही थी. दिस इज अ कॉन्सेप्ट फॉर इन्फ्लुएंजा वायरस. सो एंटीजेनिक शिफ्ट इज ड्रास्टिक एंड सडन एंड मेजर चेंज, एंड इट इज capable of causing pandemics, while antigenic drift is a minor change and it is capable of causing endemics and epidemics. So what is internship antigenic shift? So what happened with me is, thus we have got same people around us horizontally, like our colleagues and batchmates. So during the final year, we all were studying together for exam, and if someone does not understand anything, he or she used to come and ask me, or then I would explain if I knew the concept. As soon as the result came for final year and the internship started, I saw people changing. I saw people changing, their mindset changing. There was a drastic change in their attitude. So it took me around 2 months to absorb this thing, basically, because I was unaware like people would change. It was a reality check hit to me, because the same people who are like, please ये सिखा दे, please वो करा दे, who are you? I don't know you. Mind your own business and all that stuff. So basically people change, their attitude changes. So I'm just telling this to you because if it happens to you, you know that this happens, so you wouldn't perceive it as a shock. So shock is an emergency condition. Academics apart for now. Then this is the thing. So be ready for this thing if it happens. Then internship is all about teamwork and smart work. Okay, बहुत सारा काम होगा. You will be having a lots of work in some postings, like hectic ones. So like filling the discharge summaries, taking rounds, taking vitals of so many patients, monitoring and all that. You have to be very smart and quick. And also teamwork is really really important. Teamwork with whom? Teamwork with probably one more intern will be posted along with you to places if your timetable is accordingly set. If not, take help of nursing students and the nursing staff. Tell them genuinely that itna kaam hai, we'll be dividing everything and we'll complete it together so that we can get free faster. Okay, so you will be also relieved, I'll also be relieved. You have to develop that thing of communicating well with the nursing staff. We'll come to that later. So here are a few things which you are supposed to do mindfully during internship. You are supposed to mindfully deal with the patients. You are supposed to mindfully write the discharge summary and the follow-up, because these things are going to help you become a better clinician, and also they will be helping you in MCQs. Believe me, I am saying I just gave NEET 2023, and I am sure if you do internship very mindfully, you will be definitely able to solve 100 to 120 questions with ease. Okay, just do it mindfully and be aware of what you are doing. You will be getting 20-30 discharge cards to write, discharge summaries to write in a day, but do that mindfully. Just don't be that another clerk which is just going typing and writing the discharge summaries. Please don't be that another clerk. Do it mindfully. These things are going to help you. I am telling you with this experience. Okay, you are supposed to mindfully monitor the patients. Okay, monitoring is really important. If the patient is serious, monitor it mindfully. Okay, because it is really important. It will decide the course and the progression of the disease, the prognosis of the disease also. Mindfully perform every procedure, even if it is a small stitch or any small dressing, perform it mindfully. See the steps, follow protocols, try to follow the protocols as many as you can follow, because these things will be helping you in the exams as well as in life, of course. Mindfully prescribe investigations, or mindfully see what your senior is prescribing as investigations or medicines also. Ask them if you don't know. Do not hesitate to ask. Please ask and you shall receive. Please ask. I am telling you, if you won't ask and hesitate thinking that what the other person will think or what your senior will think, then it will hamper your growth or learning. So please ask. Never ever hesitate in asking. Ask politely, ask genuinely, as if you don't know. Okay, no one will say no to you to teach. Even if he or she is a nursing staff or nursing student, they'll be more than happy to teach you if you ask genuinely. Okay, be genuine. Just that is the thing. So all in all, you are supposed to mindfully perform, I may say, mindfully do your internship. Okay, coming to the must buy things for internship, according to me. So you are supposed to buy 2 pairs of scrubs. What are the scrubs? Scrubs are for one for they are usually for the aseptic zones or OT basically. So why 2 pairs? One pair if other one is in wash. I used to wear scrubs wherever blood contact was possible. So for example, labor room also I used to wear scrubs, but I used to make sure that these scrubs are washed before the next wear. So this is very important. Second thing what I would suggest is buy a diary and pen. Okay, why diary and pen? In this era of mobile phones, you can keep mobile phones. Just I am more of a paper and pen type person. So by that, whatever, I'll tell you my first day experience. It was like I went and there was a senior of mine who gave me, ये पेशेंट का वो करवा देना, इसकी इन्वेस्टिगेशन भेज देना, इसके रिपोर्ट्स कलेक्ट करवाना और इसके सैंपल्स कलेक्ट करके भेज देना और इसका फॉर्म भर देना, इसकी डिस्चार्ज समरी भर देना और इसका ऐसा. He was pointing like this, and it was first day of my internship and I was totally lost. What am I supposed to do? How will I be able to remember all this? And after saying all this, he went away. Okay, so basically this thing will happen throughout your internship, but you will get acclimatized to this. So how are you supposed to get yourself acclimatized in this condition is keep a diary and pen, write down stuff. I am not telling you to underestimate your brain or memory capacity. This is not necessary. Okay, it is of course important. You can write it down and finish things one by one. That way you will not miss one thing, and also you won't be putting faltu stuff in your head. So why waste your capacity and ATP that way? Write it down and do things one by one. Remember one thing at a time. Baby steps. Take small steps. You will be able to do it very well. Okay, unitasking is the key, because our brain is designed in such a way that unitasking is really really important. You try this thing, unitask and multitask, and you will see the difference where you can give your 100% and where you are able to perform better. Okay. Third thing, footwear is really really important for internship. So 2 footwear, one for operation theater, that is aseptic zones, and one for the wards and all that stuff, OPD wards. Footwear is very important. It is supposed to be very comfortable, because you are supposed to stand a lot during internship. What I used is I used Crocs and also Skechers car shoes are comfortable. This is not a sponsored video, but what I used, what I am telling you, I tried various things, but these two are the top most comfortable thing according to me. If you are able to afford, then please buy these. If not, it's also fine. Okay, it's how we train ourselves and how we are habitual. So just footwear is important is what I mean. Fourth thing, which is must buy, you are supposed to keep some dry fruits or energy bar in your bag always. Okay, there is possibility that you won't be able to grab lunch or so. keep dry fruits and energy bar, and whenever you are eating, please share with your co-colleague. Okay, sharing is really important because teamwork is the thing. I always say collaboration is greater than competition. If you have to move ahead, you have to collaborate. Okay, you cannot move ahead alone. It is all about teamwork. Okay, please share with your colleague, with the nursing staff. Keep adequate amount of dry fruit or energy bar, whatever you are keeping. Keep something to eat basically, and apron if you have that protocol of wearing apron in internship. So keep that apron up here probably. Then I have written a separate heading and it is called ask, ask, ask. As I said previously, asking is really important. Ask and you shall receive. Don't be shy, don't be hesitant at all. Grab the opportunity, okay? And also one of the strongest tool of internship is observation. Your primary method of learning will be observation during internship. Observation and then performing. Observation, performing, observation, performing. This is what you are supposed to do. Observe mindfully. Please observe mindfully, okay? Then dealing with the patients and patients' relatives is what you're going to learn next. Dealing with patients is really, really important because the target population has changed. In future, you'll be dealing with the patients. So even if it is your 100th patient in the OPD in the tiring Monday morning, but you are the first one to address the patient. So patient comes with a lot of hope that he'll be treated well and cured by your medicine or any surgical approach, whatever. So please do not get angry at him or her. Even if the 99th patient has been very tough for you and he made you angry, but please don't lash out your anger on the 100th patient. Deal with them properly. Do not get angry, please. It's humble request. Do not get angry at patients. I know some patients are worth anger, but still try not to be angry and deal with them very tactfully, and you will be learning that skill. It's a learning phase. Okay, you will get angry a few times, then you'll realize, then again angry, then realize, eventually you will realize. So just keep this in mind. Also, dealing with the batchmates and co-interns, be very clear, okay? Before the start of the day, anyone who is posted with you, be very clear that you both are going to do equally work. It should not be like you are not, the other one is not doing work and putting all the work and you are running away and bunking the duties and all that stuff. Be very clear, communicate well, genuinely, that whatever work is there, we'll finish it fast and quick and smart. Okay, so communicate with your co-intern very well. Dealing with money, so internship is a phase where you'll be getting stipend, okay? Hopefully, if you are from a government, semi-government college, and probably private colleges also give stipend. So dealing with money is what many doctors are weak at, so you have to learn that, okay? Please, I am not telling that start saving from the first day itself. After the first and second month of internship, please start saving, okay? Start saving and invest it well. Not, I would not suggest in share market or anything. Invest in safe places like mutual funds or FDs. FDs usually give less rate of interest than the rate of inflation, so it is not worth it as such, but still, you can do that. Mutual funds are also good. So basically, money management is a thing you are going to learn, or else save. Probably saving is the thing what I want to mention. Now dealing with death, okay? So there will be many days where patients will be dying in front of you in the ICUs, in the trauma center, in the emergency medicine department, in the ICCU, anywhere where you are posted, there are possibility of death. Okay, so I would not say that forget that and see the next patient and move to other thing. No, no such toxic positivity things. Just feel the emotion. If you are feeling sad, sit with yourself. Share this thing with your friend or family or colleague, anyone. Just do not feel that thing in system. You are not feeling good. You could not do anything. You would feel like यार कुछ भी हाथ में नहीं था, ठीक है? There are chances even after giving your 100%, trying everything, that a patient could not be saved. Please understand, things are not in your hand completely, okay? That is a natural phenomenon and वो होता है. अगर तुमको दुख फील हो रहा है, you are feeling pain and sorrow, sit, okay? Do not suppress it. Do not suppress it. Do not think of anything else कि भाई ये नहीं सोचना है, ऐसा नहीं. Let that emotion flow. If you feel like crying, cry, okay? Cry. Do not hesitate ever in crying. Crying is one of the best methods of venting out, okay? Vent it out. Do not keep it inside your system. Also, one fact is, crying is not equals to weakness, okay? Crying does not anywhere come near weakness. You can cry basically, okay? Crying is not equals to weakness. Now dealing with the staff, so teachers during internship, first and the best teacher is the patients. You are going to learn from the patients prima facie, okay? Observe what your seniors are doing, observe what the patient has presented with, observe what treatment is given, observe, okay? Patients are the best teachers during internship. Number two pe we have got two people who are the best teachers in internship. First one is residents or seniors, okay? They teach a lot if you are genuine with them and you help them, okay? You will be at their place one day, so you will also need help. So universe reflects back what you give to the universe, so help them basically, okay? The second is the staff, the sister and brother, okay? Sister and brother teach such things which no one else can teach you, and they have got so many years of experience, okay? They teach a lot. They have worked with many people. They have worked with your HOD, associate, AP when they were below their level as they are today. So they have got experience of various departments, various peoples, and various colleges also, and they'll teach you basically skill set is what you are supposed to learn from the sister and brother. And then third level where we have got books which teach us. So this is the hierarchy of teachers during internship. Now, so coming to PG exam prep, how to, my experience, my mistakes and path forward, okay? How to is, you will be having some tough postings and some light postings. So during the tough postings, please make sure that no day goes empty without you learning anything. Okay, even if at duty hours or after that, just make sure to at least read for 5 minutes. Okay, कम पढ़ो काम का पढ़ो. Okay, you that some one thing can be just one poll. Okay, so please do something. Basically consistency is the key. Okay, and during the light postings, decide make a timetable that way that you are able to study more during your light postings and high yielding, and solve grand test. Like frequency, all that depends on you, but solve it mindfully, and also the previous year questions. Okay, you might have been guided by your seniors or many other YouTube videos. Okay, so follow it according to your shraddha. Second thing is my experience. My experience during internship was very good. I did many mistakes. I don't. We all why do these people take sessions on White Army? These seniors like Kunj and all that. Priya, we all are of the same batch only. So why are we taking this session? This session is because telling you about what mistakes we did, and so that you don't repeat the same mistakes. Okay, please don't repeat the same mistakes which we did. So this is the motto of this session. Okay, so what my mistakes were: I started studying from the start of my internship, but during the heavy postings I was not able to study well. So by the end of the heavy postings I was like यार कुछ पढ़ा ही नहीं है इतने दिन, तो अगले साल ही अच्छे से अटेम्प्ट कर देंगे, अभी एंजॉय कर लेते हैं और फिर देखा जाएगा अगले साल क्या होता है, मतलब अभी पढ़ना नहीं है. फिर after 5 days I used to get guilty and again get back to studies. So the point is, these 5 days that got wasted in the dilemma, these matter. Okay, so please don't waste these days. Of course there is you got more work, so you won't be able to study more, but when you are having time, which is the next day of the heavy posting, utilize that time. Okay, so do not try to control the uncontrollable. You cannot control anything, first of all, but you can make the best of whatever is available. Okay, so I wasted that time after every heavy posting, which is like summing up in toto comes to around 1 to 2 months. So please, these days matter. Okay, do not waste this time in such a manner. Also I practice less questions, and so please make sure that you inculcate questions in your study method. Coming to burnout and mid-internship crisis. Mid-internship, after 6 months of internship, you will be like, one day, what am I doing? Why am I doing? What is the purpose? Is this all necessary? Why do I have to study? Why do I have to stress so much? And so many things all together bombarding in your head. You will be lost. Okay, this can happen. So when this happens, please take some time and come back. Okay, do not give up. This is my humble request, that do not give up. Okay, eventually things will fall into place. Okay, whatever is best for you, you are going to get that. Come back. Burnouts are real. Do not keep it inside. Please take care of your mental health. Promise me that you will be taking care of your mental health. It's a humble request. Take care of your physical health as well as mental health. Talk to your friends. If you don't have friends, talk to your family. Now you will tell me that you have family issues and all that stuff, but even if you have family issues, believe me, just by sitting with your family, half of your stress will be gone. Okay, make it a point, talk to your family every day, every single day, even if it is a 2 minute talk. So basically internship is preparing for residency. Okay, these things also apply to residency. Talk to your family, talk to your good friends. Okay, please, your growth and mentality will depend on your micro milieu. What is milieu? That is internal environment, the 3-4 things, the 3-4 people with whom you deal with every single day. So please choose those people very wisely. And vent it out in a very healthy manner. Okay, practice journaling, anything, any manner you can use, but do not keep things in your system. Take care of your mental health. Okay, come back, don't give up. Okay, everything will fall into place eventually. Whenever is the right time, you will get the best thing which is for you. Okay, never ever keep the fear of judgment. This is one of the most biggest risk factor for developing atherosclerosis. Just kidding. Never ever keep the fear of judgment. It will stop your growth. Okay, you won't be able to learn anything if you keep the fear of judgment. Everyone is doing in their own journey. Okay, please do not keep this fear of judgment. Even if you don't know what homeostasis is at the starting of internship, you can learn. Okay, there is always a scope of learning and getting better. Do not keep the fear of judgment, and do not ask because of this. Stop complaining. Even if you are in a peripheral college, even if you are in private college, you do not have patient load. What you can do, you cannot do anything. Okay, whatever you have, you can make the best out of it. Okay, so please stop complaining. If you will keep on complaining, then this is a vicious cycle. Basically, you will complain, then you will get distressed, then you will again complain, you will get distressed, you will get sad. So this is a vicious cycle. Basically, it won't take you anywhere. Stop complaining. Please make the best out of whatever is possible and whatever is there with you, and do not take any pre-notions that this posting will be tough and heavy and you won't be able to study anything. Choose yourself. Okay, decide yourself. Whatever anyone has said, they have shared their experience. Whatever I shared my experience. Okay, it's not necessary that this will happen to you. So decide your own path and your own journey. And also remember, internship is like, if you are giving medicines to the patient, patient is coming for very non-specific complaints like इधर दुख रहा है, माथे में दुखता है कभी, और फिर of course after ruling out the various things, if you get to know that it is very non-specific, then even if you prescribe vitamin B complex or paracetamol with confidence, the patient will get better. Okay, this is called the placebo effect. So how you give is really, really important than what you give. I won't say then what you give. Of course, what you give matters, but how you give is also a very important thing for deciding whether the patient will come back or not. Okay, so this was probably the gist of the whole session.